I'm getting it.
How is an MOU different than a contract?
That is a great question. So, Christy, are you able to speak on that? How MOU is different than a contract?
I mean, for us here at CEI, it's more of an MOU is more of a verbal in writing thing, where the contract is a very official document that states out all the things that each entity is going to do. Where in an MOU, for example, we have one with a private provider in our area, and it's just a simple letter that says we agree to work with CEI, CMH on such things, and then it's signed by both providers. Where a contract lays out, just like if you were to, it reminds me if you were to do a contract like with an AFC home, you're going to pay so much, and these are the expectations. So contract is much more detailed than a mutual letter of understanding, but it may be different around other counties. We don't have as many MOUs as other counties.
So I had a kind of a follow-up question to that, Christy, if you don't mind. So what would be a reason why someone might want to use an MOU over a contract or a contract over an MOU?
Not as binding in my mind.
Hmm.
Contracts binding, two parties, agree to all of these things. Not my area of expertise, the contract division, but I mean, I don't know, but most agencies have their own separate contract agencies. And for us, an MOU doesn't have to go through like our finance or our other agent contract entities. It's just two people can come basically, like our court team came together with one of our private providers, and this is what we agreed to do. But it didn't have to go through, like, contracts have to go through like our board of directors and everything. These don't have to do that.
Okay, so it sounds a little bit more
Less,
accessible in some
yes.
ways. Great.
But what would you use it for? Please give me an example.
So what we use ours for is sorry, that's our core. We use it, just like I said, for some private providers. So we have an agreement with what we call our ETCH program, which is a program that provides services to the newly diagnosed schizophrenics. They have a real specialty program. And so we have many individuals that are on court orders that are under that program, that program has agreed to work with. So then we just have a letter of understanding that if we have individuals that we feel are appropriate for that program and they've accepted that referral and they're on a court order, then we have a letter of understanding that ETCH will provide those services and then be in contact with us about that. ETCH recently changed to Navigate, but so that's what we use it for. So it's just to get, like, what I would say, like, if you're trying to work in the private sector, meaning you have folks on court orders right now and they, like, say have commercial insurance and they already have a provider in the area, you may want to use that letter to have an agreement with them that says they agree to provide the clinical services to this individual or to individual's court order and report back to the overseer of the order, if that makes sense. There's no exchange, the money, there's nothing, like, nobody's getting paid for services there. Do you know what I mean? Like AFC, CMH is, paying in this contract, what have you. But the letter of understanding is there's no money or financial pieces to that.
Does it get you around releases of information?
Well, keep in mind that it's a continuity of care when you're talking about court orders and care in treatment, and also court orders are public information as well. So yes, it would get you around that because this person has been court ordered to treatment, and you have to have a connection and a collaboration of care to their provider, and you're the overseer. Technically, the court order indicates, like, us, CEI, CMH. So we hold that court order, but we have to share that information with the treatment provider that they're on a court order. And then in vice versa, that person also, the treatment provider overseeing the care, has to let us know as well if they're complying or not. That's part of the program. So yes, it gets you around that.
Good to know. Thank you.
Mm-hmm.
Thank you so much, Christy. Is there anyone else that that wants to share some MOUs that they may have in place and who they're with and how that might have come about?
Yeah, I can, we don't have specific agreements with, what we usually do in Macomb County is we'll send a letter to each provider. So if someone's sent to or discharged to a certain agency, we'll send that agency a letter saying, hey, this person's on a court order. Please let us know if there's any issues in noncompliance or change in level of care. And yeah, as far as confidentiality, they can let CMH in the court know if someone's non-compliant with treatment and share relevant information regarding, if that person's in danger because of that non-compliance. But like specific information, you probably do need a release for. But there's that gray area where, you need to share enough information to make those decisions.
Yeah, absolutely, Brian. Just to be clear, yeah, we're not going to share, the therapist is not expected who's overseeing the care to share detailed, things that happen in the session, but right, just to confirm the connection to services and their level of compliance and so
Yeah,
forth.
just enough information to make a
Yes.
decision whether or not we need to modify the order or take action.
Correct.
And like, we don't, with the MOUs, we don't like send one to each agency. It's just when that person's on an order. So it kind of is serving the same purpose. And it opens that line of communication. And especially like for private agencies, I'll send the letter and a copy of the order, just so they know it's not just some random person sending a letter.
Brian, do you find that those letters do in fact open that line of communication and you get and you're getting communication? Like how is that working for you?
Yeah, it's over the years, it's been hit and miss. Some agencies don't have any idea and some will call me and immediately, or I try to send them that and then I'll call and just make sure they understand. I've had some agencies not want to take someone on a court order because they thought it was a criminal thing and they had to write all these reports and do all this extra information. And, I explained to them like, no, you're the driver of the treatment. I'm just the one reporting to the court whether or not that person is compliant with treatment or not. So it's gotten better over the years. Some agencies are a little better than others. The VA I've worked with before, we've done AOT petitions through the VA at times.
Great. Lovely. Thank you so much, Brian. So yeah, that's great. Is there anyone else that has that'd like to share a little bit about what they may be doing in their county? Whether or not, maybe not with MOUs necessarily, but if there's another mechanism that you use, like what Brian had said about letters to providers.
I mean, I can talk again. We do that outside of our specific MOU that we had with that certain provider. We do also send letters to every single provider. And we do just as Brian does. Every provider, we send a letter that explains the order. We provide our contact number to report any concerns. And then we also send a copy of the court order. We found the same as Brian, but over the years, we are finding it to be better based on the education because now providers out in the community are understanding more. And I think it helps that they know that they have someone to call and talk about to talk to and review the order with and understand that, because in many private providers, like Brian said, have never seen this. They think it's criminal. They have no idea. And then they just see all of a sudden, oh my God, now I have more responsibility, more workload, what have you. But having that support from the CMH has been huge. So we do the same thing. Every single provider gets a letter with a little bit of information about the order and then who to contact to discuss concerns. And we also ask that they call us to indicate that they've received it and they agree to follow through and support that order. Because if not, then we are responsible for either finding someone else because our name's on there or monitoring that ourselves.
So in terms of MOUs or just informal agreements kind of like that, can anyone speak to any barriers that you've experienced during the process of just getting people to come to the table to just agree to these sets of expectations and collaboration and how the workflow goes?
Can take a long time to get an MOU signed by all parties. Just because some of the bureaucracy and all that, not necessarily because people don't want to sign them, but just because of the different channels. So it is easier than a contract a lot of times, but it can also be difficult to get it signed just because of the structure of organizations.
What does MOU stand for?
Good question. It stands for Memorandum of Understanding.
Okay.
Probably
And
better.
is it kind of like similar to the deferrals?
It is
So-
not.
This is an agreement between two organizations as opposed to an individual on an order and the court, or an individual on an order and the CMH. So it's actually usually the CMH and a provider agreeing to what services will be provided for an individual on an AOT, or the court and the CMH agreeing to certain things that they'll share regarding individuals on an AOT or an order.
Thank you.
You're welcome.
Does, we don't use one, but for people who do you specify if somebody has a history of non-compliance and they are on an injection and it's felt that they should stay on it, do you specify that as part of the memorandum of understanding, or do you kind of let, that provider is going to do what they think is necessary? Because I think sometimes we have people who request to go elsewhere because they know they can talk those providers out of the injection. They're not quite comfortable with the injectable medications in general. And so I just kind of wondered how you manage that, those types of things.
I would say for those individuals, that could be an understanding with the court, but the court just makes an authorization with the order. So the order is an authorization for services that were requested. So the court should be driven by what the clinical recommendation is by the CMH. So the court shouldn't be going over the head of the CMH. So if you recommend injectables, then, that should, if it's not included on the original order, that should be a modification to the original order that the CMH can complete. But the court shouldn't be the one that's dictating what the treatment looks like. It should be the other way around. But that could be spelled out in the MOU, that the order is clinically driven. So, the CMH will make recommendations to the court and the court will modify the order based on the recommendation of the clinician or the treatment team.
I think it's twofold, Dr. Sperling. there's the court piece of it, and then there's the providers, right? That it
Right.
gets pretty, so you're right, we have several of those individuals at consumers maybe who have been on an injection or what have you, and they're like, we heard that this provider doesn't make us. And so basically what we've had to do is we send them that court order, and if there it says injections, they need to comply with that, and that does get tricky, and we've had folks, come back as a result of that. We really try to work, like you said, with those new providers, indicating like, here's the history, here's what happens. The unfortunate piece is if they're willing to see them and that's where the client wants to go, then we do, and unfortunately you end up kind of facing those consequences, right? And then they return. It just makes me smile because we are dealing with that exact same situation right now. And we kept telling the provider, listen, this is what's going to happen. And after so many calls from primary care and the police, the provider reached out yesterday and said, yeah, no, we can't do this anymore. And so, yeah, it is just we don't have an MOU with that provider, but we do when we pass that case on, especially if they've been connected to CMH in the past, we let them know, like, this is probably why they're coming. These are the concerns. And if you still want to follow that order, feel free, but here's what's required of the order.
Yeah, because we've sometimes had people, community providers, they're trying to do their best, but
Absolutely.
they end up, the patient ends up spiraling off of the injection. And then all of a sudden they're saying, we can't do this. We don't want to do this at all. And that person is now kind of not quite in a crisis, but getting there. And we're trying to find them and reestablish services. So it can be really disruptive. And I think it does. It's difficult then because some of those providers then really question about following with anybody afterwards. So it takes a lot, I think, to address that.
And getting your judge on board too, because what we've had happen is many of these individuals they've been through the system, so they know like the jury trials and all of those things that they can ask for, and they do that. And now what happened with our particular case is it went to a jury trial, and the outcome was they could stay on the order, but they could go to this specific provider. And you don't get a choice, and that it's going to come back. And so those are things. So really having that relationship with a judge to say, listen, this has been tried before with this person, like they really need to stay with CMH. I understand their desires, but if we could just put on here that they're court ordered to CMH and not any other, I mean, those are some avenues, but yeah, it does get tricky because there's person-centered planning too. We also want to make sure,
Right.
People are feeling comfortable with their provider and but it's tough, very much so.
And even trauma-informed care, many
Yeah.
times patients will feel that CMH is part of the hospitalization. I've had people say, well, your hospital did this to me. It wasn't my hospital, but we are part of that handoff, and so the part of that's traumatizing and out of their control. Certainly we want to address those issues as well. So. I mean, we're, up here in a rural area, so I think we meet with our primary care providers. We know them in the community. I do a lot of coordination of care, so we're with few providers in rural areas. We have that ability to, we know them pretty well. So I think we haven't kind of formalized it, but I think this would be a great option for us to just put some of those things into writing and, help to solidify that.
Yes, could someone repeat again the types of things that would be put into an MOU between, say, the CMH and a community service provider? So it would be things like their treatment, what that agency is expected to do versus what CMH is supposed to do. Is that the sort of thing? that goes into that.
Yes, so for an MOU, it is less about the actual treatment plan and more about the how the two entities will work together. So what you would include in an MOU is the purpose and objective of it, the roles and responsibilities in which both entities have to the individual and to one another. Also detailing the scope of work that it would include, any communications and meetings that you may, expectations that you may have with one another in that way. And let me think. Am I missing anything, Chris? I mean, I'm sure I am because it is very specific to, you know, how you want to work with the entity that you're creating the MOU with. But yeah, Christy, is there anything else that I'm missing?
No, it's just more of a general thing. You don't typically lay specifics out. Like she said, it's just like this is what they've agreed to work with you on these certain cases. It doesn't go to, like I said, a specific contract committee who has to sign off on all of it. It's not going before your board of directors. It really is just a general letter that says, hey, we agree between the two parties, this is what we're going to do. You know, John Smith's agency has agreed to work with CMH on the following cases to provide these services for court ordered individuals, kind of thing. Can be pretty, I mean, that's how it is here. You know, I just don't want to speak specific to other agencies, but in general, it's just a lot less of a detailed understanding that would be outside of a contract.
Yeah, it seems like it's a more accessible agreement if there is not, you know, a contract, if the contract is not an option because of various reasons, it's a more accessible way just to start building that relationship or formalize that relationship that's already existing, so that there is something to refer back to in terms of accountability and just a delineated set of expectations that both entities refer or adhere to. So yeah, not as formal as a contract, but it is a good tool to use to build those relationships with service providers or whoever you're utilizing them with.